What I'm trying to do with Pain Arizona is have a better approach to opioid use disorder. I talk about something called tri-diagnosis. A lot of people are familiar with dual diagnosis, and that means that someone has addiction, but they also have a significant mental illness. And the teaching in the psychiatric community is these dual diagnosis patients should go to a clinic where both conditions are treated under one roof, because if you treat them separately or in silos, then the patient has worse outcomes. I've been teaching this idea for a couple years now. What about tri-diagnosis? They have a significant mental illness. They might have opioid use disorder. They're addicted to the opioids, and they have a major pain complaint. Some of the patients that come to see me are truly suffering. They have terrible things that hurt every day. And so I've been pushing the leaders of this state, both with insurance companies and with referral sources, that when we have these patients that have those three things, they have chronic pain, they have opioid addiction, and they have a mental health condition, we can treat them under one roof. And we're doing that right here in Arizona. My dad is a licensed clinical social worker, and he's spent his entire career treating addiction, and he works for me, and he helps run our behavioral health side. We treat people the day we meet people. I call it treat them when we meet them. And that means if we meet someone who's addicted to opioids, we don't send them out and say, you have to wait 90 days to be seen, and then maybe it's out of network, and maybe they can't afford it. We just start treating the very day we meet people. And we do that through a really unique approach called Suboxone microinductions. And if you read the literature, this is going to become the standard of care over the next decade, but it's kind of early. The data is early, and so a lot of doctors don't know about it. But someone who's addicted to builds up in their fat, and it takes about 2 or 3 days to get the thing out of your system. And so the current standard of care is we'll send people home and tell them to stop the and come back in 2 or 3 days. And I would tell people, if my brother could have for 2 or 3 days, he would have done that already. And so we're gonna change the standard of care. It almost makes me emotional. We are going to work together to save 1 million lives. And I'm thankful for my brother, that he's still with me. And I think about the good that will come from the suffering that he's been through. The education, the education that I got helping my brother find sobriety will not be lost. I'm working with some of the best doctors in Arizona and some of the best doctors around the country, from Mayo Clinic to Stanford to UCSF in San Francisco and even Harvard, to change the standard of care across the country. I call it treat them when you meet them. When someone comes in and they ask for help, you don't have to go to a special facility, you don't have to be inpatient. We can literally treat you the very first day, and we do it by starting a very small dose of buprenorphine, usually about 0.5 milligrams. It's only about 4% of the total dose that most patients will be stable on. And then the second day, they take a little bit bigger dose, and the third day, a bigger dose. And here's the key. They can continue to use, which blows people's mind. You can continue to use, and somewhere around day 7 to 10, the patient will wake up, and they don't need the opioids anymore, and they're stable on a life-saving drug. And the last thing I'll say is the data is very clear that if you take Suboxone for opioid use disorder, there's a 50% reduction in mortality. And most doctors don't know that, a 50% reduction in mortality. And the second thing is every doctor, every nurse practitioner, and every physician assistant in America can now write Suboxone. There's no special license. Everybody can treat addiction. And so I'm pushing this idea of treat them when you meet them, and I hope that we're going to save 1 million lives together.